We welcome you all to Democracy Now! Let's start with Dr. Ali Fein here in New York. The significance of the Supreme Court upholding what is known as Obamacare, the Affordable Health Care Act.
Well, from our point of view, the question is, how is this going to affect patients? And we think there are three important principles, right? Access to care, cost of care, and frankly, quality. And this law, when it gets to the issue of access, is only partial in terms of guaranteeing access. 26 million people are going to be left uninsured, according to the Congressional Budget Office, when the law is fully enacted. Yes, there's an expansion of Medicaid, but as we know, the Supreme Court curtailed some of the oomph behind that, so that there are some states that probably will not go ahead and make Medicaid available to people at 133% of the poverty level, okay? And finally, in terms of quality, yeah, there's some things in the law, comparative effectiveness research and so on, but really I don't think we have a system that can, monitor the whole healthcare quality that we have. Right now, if you look at quality studies, they're mostly done on Medicare data. Why? Because Medicare is available to everybody, all researchers, whereas the private health insurance industry keeps its data essentially private and proprietary. So this law, I think, is a mixed blessing in terms of where it leads the patient at this point.
And how big is this issue of the court ruling that the government could not penalize states that don't expand their Medicaid, their Medicaid coverage of the poor? Does that mean that there will be significantly many more millions that do not end up having health insurance? I
think it may mean that people who don't have access today will not necessarily have it tomorrow. For instance, we were just talking to our folks in Alabama. In Alabama right now, anyone who is childless between the ages of 19 and 64 has no access to Medicaid, irrespective of their income, okay? They just don't qualify. Under this law, it would have been possible for people up to 133% of the poverty level to gain coverage in Alabama. But that's not going to happen unless the state decides to accept, the option.
Jody Jacobs.